Hello, good afternoon, everyone. Welcome to the IEHP Legislative Forum, the 13th annual, here on this very chilly Friday afternoon. We're so excited to see you all today, and we will be discussing the impact of federal health policies in the Inland Empire and California. I'm Allison Elsner, and I'm the CEO of the San Bernardino County Medical Society, and I'm also the chair of the IEHP, or the Inland Empire Community Health Initiative, which is, as you know, a coalition to ensure that all families and residents have access to affordable, quality, and culturally sensitive health care in the Inland Empire, which includes Riverside County and San Bernardino County. Right now, we do want to extend an enormous thanks to Molina Healthcare for serving as today's sponsor and for being such an integral part of the IEHP leadership. We have some powerful leaders in the House with us today, including Jarrod McNaughton, CEO of IEHP, Inland Empire Health Plan, and they've been a steadfast supporter of the IEHP project and mission in general, as many of you know, since our inception 15 years ago. They were involved in the creation, so we really appreciate that. We will also be welcoming Inland Empire elected officials whose time we value so much, especially now with everything that's going on, swirling about. In a moment, we'll be introducing California State Senator Rosilicie Ochoa Bogh, California State Assemblymember Jeff Gonzalez, and San Bernardino County Supervisor Joe Baca Jr. At this time, I want to welcome our IEHP Board and Advocacy Council Advocacy Task Force members, and I want to give a special thanks to the members of that task force. So in order to do that, I'd like to introduce the chair of the Advocacy Task Force, Dr. Danielle Kilshenstein, Dr. PH, who serves as the Executive Director, Government Relations for Inland SoCal United Way and Inland SoCal 211 Plus. Danielle and Dr. Danielle and her team are responsible for planning and coordinating this annual legislative forum. Danielle, go ahead and take it away for a moment.
Thank you so much for that introduction, Allison. And I am super grateful for the privilege to be able to co-chair the Advocacy Task Force along with my colleague, Dr. Jezebel Urbina from IEHP, the Inland Empire Health Plan. We also have members Kevin Mahaney from the Family Assistance Program, Cindy Sanchez from Chaser, the Community Health Association of Inland Southern Region, Alejandro Espinoza from the Desert Healthcare District and Foundation, Alexandra Bravo from Molina Healthcare, Natasha Falgren from the Global Communities International, and Adrian Zavala from the Neighborhood Healthcare Association. But I also want to quickly shout out to you, Allison Elsner, also Victoria Stephan and Tiffany Law for all of your leadership and support to make this all happen. So thank you so much for being here today and joining us, and turning it back over to you, Allison.
Well, thank you, Dr. Danielle, and right back at you. This is a lovely partnership, and we're grateful to you. So thank you for that. And I also wanted to give a shout out, which you just did, but it's worth doing it again. I want to give a shout out to our IEHP Executive Director, Victoria Stephan, for all of her incredible work to pull everything together with all of our projects, as well as our IEHP Program Director, Tiffany Law, who's on the line with us, who's been such a welcome addition to the IEHP team, especially with the IEHP achieving its nonprofit status as of last summer. So we want to make sure all of you know that we're now an official 501c3 nonprofit. So a couple of quick notes. Please be so kind as to keep yourself on mute. And if you have questions, we're going to be doing a robust Q&A after the presentations. Go ahead and enter your questions into the chat. And if you'd like, if you prefer to do it with your voice, so you can raise your hand with the chat feature or the online dashboard, and we can take your question that way. Now, I'm super excited to introduce our featured presenter, Jarrod McNaughton, MBA, FACHE, is the Chief Executive Officer of the Inland Empire Health Plan, IEHP. In this role, Jarrod works collaboratively with the IEHP Governing Board to set the strategic vision and provide executive leadership for one of the 10 largest Medicaid health plans and the largest not-for-profit Medicare, Medicaid public plans in the U.S. He cultivates IEHP's strong partnership with providers, hospitals, and hundreds of community partners to deliver quality whole-person care to more than 1.5 million members. Mr. McNaughton earned his bachelor's degree from Pacific Union College and a master's degree in business administration from the University of Laverne Graduate School of Business. He's a fellow of the American College of Healthcare Executives. In recognition of his distinguished career and leadership in the healthcare field and the community, University of Laverne awarded him the Honorary Doctor of Humane Letters degree in 2021. Mr. McNaughton currently serves as chair of Manifest MedX, the largest health information exchange in California. He previously served as the 2024 board chair for Local Health Plans of California. Jarrod, we'll turn it over to you. Thank you.
Well, thanks so much, Allison. And boy, it's a joy to be with you all today, and really appreciate our elected officials that are with us today, because boy, you folks are right in the middle of all of this. And we're just so grateful for the work that you do to advocate for our region. So huge thanks to all of you that are here with us. You know, before I jump into a presentation, I thought I would just share with you a brief story. One of the things that I just love about local health plans, there are 17 of us in the state of California, and that local connection to the work that happens is so supremely important. And it could not be more evident than when I get out in the field, whether I'm in homeless camps, in community meetings, in the backyards of our community members, and I get to hear firsthand the impact that the Medi-Cal program has in their life. And one in particular event just happened recently. The Community Health Worker Program, CHW program is what it's also known, is so incredibly impactful for this work that happens in our communities and with our community-based organizations, our CBOs. And recently, we held a graduation. We've had numerous of these graduations, over a dozen, of community health workers that have gone through a training program. And recently, just last week, we held one that was very near and dear to my heart, because back in April of 2022, I was in the backyard of a neighborhood in San Bernardino, where I got a chance to meet Janae. And Janae's mom had been released from prison after being in prison for over 25 years. And Janae's mom, Delia, when she came out of prison, had approached me at this meeting and just said, hey, we've got to do something different and better for those that are coming out and trying to get back into the normalcy of life. And she and I, for some reason, Delia and I just had this remarkable connection. We stayed in touch. We were calling each other all the time and talking about the work that could be done to really make an impact in our community. It was not long after that that she passed away from cancer, very unexpectedly. And her daughter, Janae, really felt like she needed to continue her mom's legacy in this work. And last week, she graduated from the Community Health Worker Program. And I cannot tell you how incredibly impactful her speech was. In fact, we can get it out to you folks if you'd like to read this. I just shared it this morning with the DHCS director, Michelle Voss, because it was so impactful. That the work that is happening in programs like ours and in yours is something that I just can't even begin to share. Not only the heartwarming stories, but the practical impact, because now Janae is going out into homeless camps and connecting directly with these folks and is just making impacts beyond measure. And so for us, what we're going to be sharing with you today is a little bit about what potentially we could see shifting at the federal or state level based on what we know today. Now, it's a moving target. Every day it seems like there's something different coming. And I know our legislators are doing their very best to try to navigate during this time as well. And so with that, I would love to just kind of jump into our time together today and kind of share with you on the next slide what we're seeing right now. So right now, as you folks know, tremendous amount of change that we're hearing that could happen when it comes to federal funding for programs, as well as even state impact for programs. Just today, we finished an IE Healthcare Coalition letter that was created thanks to our two medical societies, Loma Linda University, Chaser, our Community Clinic Association, along with IEHP and our two county hospitals, sharing the importance of what happens with Medicaid or Medi-Cal funding in our community. And I'm going to share a little bit more of that here in just a moment. But you couple that with the announcement, of course, that happened this week where our Department of Finance here in California had to actually request a loan from the general fund to continue Medicaid or Medi-Cal operations in the state of over $3 billion. You start to see pressure that is being created in our state and across the federal government, in addition to what we're hearing from DC around program changes or cuts that could happen that I'll share a little bit more with you about here in just a moment. On the next slide, of course, the impact here statewide is pretty dramatic. We have over 15 million Californians are currently covered by the Medi-Cal program. About 1 in 5 rely on it, and over 50% of kids are connected directly into the Medi-Cal program. So this is something that is directly a cornerstone, if not part of a substantial piece of the foundation of the healthcare program in our state. And on the next slide, you'll see the regional impact here for the Inland Empire. You can absolutely see the numbers that it's amazing actually to see over 40% of our population today is covered just within our 2 counties by the Medicaid or Medi-Cal program. And that creates a very unique situation because that number actually has over a $20 billion impact economically to our region. Huge, huge number. Now you have to remember that number is not all coming to IEHP. That includes the pharmacy benefit, that includes the dental benefit, carve-outs for things like severe mental health, substance use disorder, IHSS workers, administration in our counties, the Medicare premium for DSNP funding and others, but the totality of the impact of the Medicaid or Medi-Cal program is huge just here in the Inland Empire. And the kind of funding that is created for our hospitals and partners and providers and physicians is absolutely remarkable. It is just vast. And so I hope this gives you a little bit of a sense of the kind of impact regionally that Medicaid or Medi-Cal here in California has right here in the Inland Empire. On the next slide, you'll see a little bit for us here at IEHP specifically. So out of the 2 million of the Medi-Cal lives, about 1.5 million are covered today by IEHP directly. We have contracts with over 9,000 providers. As you can see there, all of our hospitals in the IE and beyond are connected to us. And you see that we employ a vast amount of people to help this work continue. Over 4,000 jobs in the region. I share that with you because on Monday, we actually shared with our board kind of a doomsday scenario of what would happen to our organization and the community if particular pieces of funding were pulled apart in the Medicaid or Medi-Cal program. And I'm going to get into a little bit of that in just a moment so that you can see practically what we're concerned and worried about. But on the next slide, I want to first talk about our members. You know, when you hear numbers like 1.5 million members or 2 million in the Medi-Cal program and totality in the IE, a big question always is, okay, well, out of that number, tell us a little bit about the direct impact that's happening for people that are on the program with chronic conditions, as an example. Well, just in our organization, about 280,000 of those Medicaid or Medi-Cal members actually have some kind of ongoing treatment for chronic illness. And it's important to note that because for us, that connection to care is not only about the care continuity, but about literally making sure that they have access to life-saving treatment for everything that you can see on the screen there, from hypertension to diabetes and asthma. So very, very practically important for a very key piece of our community who relies on this for chronic conditions as well. So on the next slide, I'll jump into a little bit around a little bit more specifics on the impact to providers. As you probably hear, it looks like it depends on kind of the day of the week on which areas that the federal government is looking at potentially cutting or reducing in the Medicaid or Medi-Cal program as it's known here in California. And right now, our system in healthcare is really cobbled together with financing mechanisms that are just unwieldy. It's like a Jenga puzzle. If you pull any piece out, the entire house of cards can fall apart. And you see on the screen, some of the things that are connected to that Jenga puzzle, but I wanted to point out in particular that, of course, Prop 35 just passed for the managed care organization tax, which is a way for us to basically try and pull down extra federal dollars into the Medi-Cal program that would directly support hospital emergency rooms, physicians, reimbursement to try to get them a higher reimbursement rate for their own sustainability in their practices. But all of those what's called provider taxes, whether it's the directed payment program that our hospitals get, intergovernmental transfers that our hospitals and providers get, all of those are right now what it appears to be under the microscope the most at the federal level. So while we're not hearing as much today about potential changes in the federal share to the Medicaid or Medi-Cal program, we are starting to hear the federal government take a real close look at some of these directed payment programs through provider taxes. Now, this is important to note because here in the Inland Empire, hundreds of millions of dollars flows through us to hospitals and to providers thanks to these provider tax funding mechanisms. And so it's important to share that because if those were cut, there is no question in my mind that rural hospitals in our community would either be cut down to literally just an emergency room or they would close. There is no way today for our rural hospitals in particular to have a sustainability without those provider taxes in place. I share that with firsthand knowledge. I used to be a hospital CEO, and my prior life before being on the health plan side, I was in hospitals my whole career. And today, we have around 5 to 6 of our hospitals who actually regularly ask us for advances on their directed payment programs for them to even just make payroll. So it is something practical. It's something we're seeing in real life. We've seen that for years now. And so that's why that provider tax piece of this Jenga puzzle is so incredibly important to make sure that we retain or we find a way to make folks whole in another way. I also wanted to share here that as no surprise to you, the other piece to this that's so important is that the IE has one of the lowest provider to population ratios in the state of California. In fact, my home county is Kern County. That's where I was born and raised. That county, coupled with the 2 IEs along with Imperial County, the 4 of us are ranked right at the bottom of provider to population ratio. Thankfully, years ago, IEHP set up the Network Expansion Fund to create a way and a mechanism for us to provide dollars to recruit additional physicians here in the Inland Empire. That has done incredible to bring physicians here. Over 500 providers have been recruited thanks to that program. So successful and the first of its kind that the state of California actually used our model in the IE back when they had a little extra money to help providers in this same scenario, actually used our program as a blueprint for how they've provided funding to physicians recruitment areas for high need areas. That was so successful that our board then said, let's create the Healthcare Scholarship Fund. Let's go up in the pipeline and provide 50 full ride medical school scholarships to the 3 medical schools here in the Inland Empire. So that's Loma Linda, UCR, and CUSM. Now we have over 230 physicians and nurse practitioners in behavioral health in that pipeline that have a time requirement to actually stay in the Inland Empire after they complete their residency program. All of those programs would go away if provider tax fees are changed or if substantive changes to the Medicaid program are brought forward. There is simply no way that they are sustainable given the very, very narrow margin. In fact, last year, some of you already know, I sent out regular provider videos, very transparent with our finances. We had a very difficult year last year, losing about $340 million post-COVID because utilization spiked so fast for us here in the Inland Empire, which is good that people are using the benefit, but we needed to make sure the state kept up with the rates for that. So I share that because already today there's so much pressure financially on the Medicaid program, Medi-Cal here in California, that we just want to make sure that as changes potentially are made, that we really are at the table. And I'll share some of our ideas on that here in just a moment. But on the next slide, we'll see if we can get this to work. We thought we would just share with you a recent video that I just sent out to all 9,000 of our providers, sharing some latest insight. So we'll see if we can get this to play for you.
Well, hello, provider partners. You know, as you probably know, there is a lot going on in D.C. and a tremendous amount of potential changes and unknowns to federal programs. Recently, the House voted to adopt an initial blueprint for a bill that could slash Medicaid funding. And we thought that it would be important for us to share with you what could happen if certain cuts went through. So let's talk through just a couple of scenarios. Scenario number one. Now, we could see a whole host of other levers being pulled to lower the enrollment and eligibility for Medicaid, including the elimination of the Affordable Care Act expansion population. Now, this means if less people are eligible for Medicaid or Medi-Cal here in California, the number of lives assigned to you by IEHP could be cut. And this could result in a significant decrease in your office's revenue. For example, we know that 33% of IEHP's Medicaid membership is the expansion population. And if that population was removed, a provider could see a similar reduction in assigned lives. Now, for hospitals, we could see an increase in the uninsured population and charity care rates and a surge in ER utilization. Now, let's take a look at scenario two. Now, we could see changes in provider taxes and payment programs. For example, today, if you receive payments for the MCO tax, targeted rate increase, pay for performance, hospital-directed payments, including IGTs or intergovernmental transfers, you could see deep cuts to the amount of money coming into your practices or hospitals. Now, furthermore, if the hospital-directed programs are cut, we will likely see service lines go away and even the closure of some hospitals. All of this because our healthcare finance system in the United States is the most complex and unwieldy system ever created. I kind of often say it's like a Jenga puzzle. You know, you pull one piece out and the entire structure collapses. Now, as providers, you are our partners on the front line. And while we don't know and cannot forecast all of the potential cuts, we wanted to be sure you were as well informed as possible as you create contingency plans, make provisions, and reach out to your advocacy groups, hospital associations, and medical societies. They'll even have more resources for you on this. Please know just how much we appreciate everything you do for our members and the community.
Thank you guys so much. That's great. That's perfect.
About the important care that you provide. Thank you so much for all you do.
So we just shared that briefly with our provider community, just to let them know kind of what's going on at that moment in time. And some of you that are on our provider list, you get those videos regularly from me just to try to keep you updated as best as we can. And Dakota, I saw your note there. We'll be sure to get that video out to you as well, so that you can have the closed caption version as well. I apologize if that wasn't coming through for you. Thank you for sharing that. But finally, on the next slide, I wanted to share some of our policy priorities with you folks. And I'm not going to read these because I know you folks can see them and read them, but I'll just share with you in brief that our goal with the advocacy work that we're doing at the state and federal level is to make sure that our members are really connected to the care that they need. To make sure that we're actually efficient in the way that we do that, as well as providing access to quality healthcare. I am so pleased that IEHP actually received our highest quality rankings in the history of our 28 years this last year. It's phenomenal. And the IE should be so proud because we have a saying at IEHP, if it can be done in the Inland Empire, it can be done anywhere in the country, because our geography, as you guys know, and just the regions that we're working with that provider shortage is really challenging at times. that kind of quality ranking, in addition to having the highest star rating from our accreditor in our history last year as well, does not happen by accident. And that's thanks to all of you, our providers, who actually do the work on the front line. So for us, that sustainability of keeping healthcare excellence in our region, rising the tide for all boats, is absolutely vital in the work that we're doing. I share that at the same time, just this morning, the 17 public plans in California, known as the Local Health Plans of California, every Friday morning, all of 17 of our CEOs, we connect and talk about how we can really better meet the needs of our community. And today we were talking with some federal folks, and it's pretty clear to me that the current state of healthcare financing is just not sustainable into the future. And we really do believe that it's our duty to be at the table to co-create with our state and federal legislators, who have a very difficult job trying to get some of this stuff under control, on what we think could best serve really making sure that the cuts are not so deep that it's actually impacting dramatic impacts to the Inland Empire, but that we actually come forward to share ideas that we have on ways that we can be better stewards of public funds. And I reminded our team today that the entire reason that the managed Medi-Cal program in California was actually created was to actually do just that. It was to be the best possible stewards, because on the state fee-for-service side, it was so unwieldy and so difficult to get your hands around that's why the state made that decision. And it's a principle that I think that regardless of party, everybody can agree that we're actually very, very strong stewards of this work. We have no shareholder value. All of the dollars flow to our community providers and hospitals. And so our real goal is to make sure that we're doing our part to cut out fraud, waste, and abuse in the system. We have excellent catchment areas in our plan for that. Our goal is to really talk with our state Department of Healthcare Services leaders about ideas that we can come to the table on benefit design to make sure that people are still connected to the plan, but that we're making sure that we're the best steward of public funds, and to talk with our federal legislative members here in the IE about ways that we can support them in some very tough decisions that I know that they're going to have to be making soon. So with that, I really appreciate you giving me the opportunity to share our thoughts, and look forward to any dialogue. So Allison, I'll turn it back over to you and your team.
Well, thank you so much, Jarrod. That was a really amazing overview, and I think it helps us to all understand what we're dealing with a little bit better. So thank you. Maybe it'll help us sleep just a little bit better at night, everyone, knowing that Jarrod is there on the case. Well, that was amazing. Next, we're going to move into our next exciting part of our presentation today, and that is our legislative panelists with our very special elected officials. So to take us into that part of the presentation, I'm very honored to introduce Dr. Jezebel Urbina, Dr. PH, MPH, who is the current co-chair of the IEHP Advocacy Task Force, and she's the current director of enrollment at IEHP. Jezebel, Dr. Urbina, has been in the healthcare industry over 20 years and has managed multiple sales channels within organizations such as Covered California, HealthNet, Blue Shield, LA Care Health Plan, and IEHP. Her passion for serving marginalized communities stems from being the daughter of immigrant parents and witnessing the various challenges faced within such communities. She obtained her doctorate in public health with an emphasis on health policy in 2018 and is a longtime champion for higher education. Dr. Jezebel, we're excited you're here. Please go right ahead.
Thank you so much, Allison. And we do have some very special guests serving as our panelists today that I'd like to introduce to you now. So our first is Supervisor Joe Baca Jr. Supervisor Joe Baca has proudly served the 5th District of San Bernardino County since 2020, tirelessly working on behalf of his constituents from the cities of Colton, San Bernardino, and Rialto, as well as additional unincorporated areas in District 5. In January of 2025, Supervisor Baca was honored to be named Vice Chair of the San Bernardino County Board of Supervisors, reflecting his dedication and commitment to improving the quality of life for residents throughout the district. Supervisor Baca knows the county of San Bernardino well, as he was raised in Rialto, where he attended local public schools and pursued higher education in the county, earning degrees from San Bernardino Valley College and Cal State University, San Bernardino. He also earned his master's from Azusa Pacific University. Supervisor Baca has been dedicated to public service his entire working life. He worked in law enforcement before becoming a teacher at Rialto Unified Schools District. He taught for 15 years in Rialto and also served the city council from 2007 to 2020, and was a member of the California State Assembly from 2004 to 2006. As supervisor for the 5th District, Supervisor Baca has been actively working with Governor Newsom and the state of California to deal with crises due to weather and to COVID outbreak. His hard work has resulted in bringing numerous infrastructure projects to the county. For our second panelist that I'd like to introduce to you, Assemblymember Jeff Gonzalez. Jeff Gonzalez is a combat veteran, small business owner, pastor, community leader, and father. A first-generation American, he served in the U.S. Marine Corps with deployments to Iraq, Afghanistan, and other missions in Honduras and the Czech Republic. After 20 years of service, he became a pastor driven by the loss of 10 Marines to suicide and has dedicated himself to supporting vulnerable individuals. In his daily life, Jeff runs a small business and volunteers in his community and cares for his son with cerebral palsy. He's committed to addressing the challenges of living in California, such as healthcare access and the high cost of living, and aims to fix these at the state level. Jeff is married to Christine, and they have 4 children residing in Idaho now. And finally, our last panelist that we have is Senator Rosilicie Ochoa Bogh. Senator Ochoa Bogh is a native Californian and the daughter of Mexican immigrants, and credits her family with teaching her personal responsibility and the value of an education and hard work. Senator Ochoa Bogh is a graduate of San Bernardino High School and the University of California, Santa Barbara. She worked towards her teaching credential at Cal State University, San Bernardino, and went on to teach English language learners at the elementary school level. In November 2020, Senator Ochoa Bogh made history as the first Republican Latina elected to the California State Senate, representing nearly 1 million residents in Senate District 23. In November 2024, she was reelected to serve a second term, now representing the newly drawn 19th Senate District, which encompasses cities and communities across Riverside and San Bernardino counties. She has been appointed Vice Chair of the Committees on Education, Human Services, Energy, Utilities, and Commissions. She's also a member of committees on Budget and Fiscal Review, Governmental Organization, Housing, Joint Legislative Budget, and Budget Subcommittee number 1 on Education. So welcome to our 3 panelists. And now I'd like to get started with our panel questions. For our first question, Supervisor Baca, do you have a preference on which question that you'd like to address first?
No particular order. We're open, Jezebel. Thank you.
Okay, so I will be starting with our first question. What are California legislative plans or strategies in relation to the presidential executive orders as they impact California laws, services, and residents, especially around healthcare?
So is this question to me, Jezebel?
Yes, to Supervisor Baca.
Now, well, I can't speak for the legislators. I know we have 2 legislators on the panel, but I can speak with potentially how this could impact San Bernardino County. So San Bernardino County has the Arrowhead Regional Medical Center, which is our main county hospital. We have 4 community clinics. We have 1 in Redlands, we have 1 in Fontana, and 1 in San Bernardino, 1 in Rialto. And potentially, if there is cuts to Medicaid, Medi-Cal, this for our services, this would be 70% of our clients use Medi-Cal, Medicaid. So that's a draconian cut that could cost us a ton. So what that tells us that 1, we have our demographics, we have a lot of challenges economically, we have a lot of challenges to healthcare in our community. You're talking about potentially anywhere from $400 million to $600 million a year being cut from our county hospital. I think that's something to keep in mind for services. You know, you're looking at potential layoffs and you're looking at potential ancillary or additional services besides hospital. But people don't realize a lot of times that, you know, our hospital is very impacted by homelessness. A lot of times many law enforcement or other communities will bring homelessness to our community. But I think one of the things we're doing is we're very proud that we're actually one of the very few public hospitals that that uses general fund money. It's all based on, a lot of these is based on reimbursements. So the reimbursements has been helpful to not pull from the general fund. I think that's a policy decision the Board of Supervisors may have to make. If these are cut, we'll have to make that decision. Do we draw from the general fund? I think that's a concern for us. And I know that Jarrod mentioned it. How long can we sustain that is the $1 million question. So one of the things that we had is an update yesterday by Ms. Erica Murray. She represents the California Association of Public Hospitals. And she mentioned at one point in time there were 60, you know, public hospitals, one in each county. Half the counties don't even have them anymore for financial reasons. So that's something the county should be proud of. But I know one of the things we are doing is we are proceeding as if things are going to continue as is. But I think we're watching legislation. We have people lobbying and sharing our story and how it would impact our community. But it's something that we're really watching closely. And it's a policy decision the Board of Supervisors may have to make. But we're hoping that these cuts are not happening to our services, but it's just something for us to consider. But thank you for the question.
Thank you so much, Supervisor Baca. Now I will turn it over to Assemblymember Gonzalez. Do you have anything you'd like to add to that question?
Yes, thank you so much. I appreciate it, and forgive my mobile office, but you know I'm always on the go throughout the district. But one of the things that I would say with respect to what was talked about before, legislation moving forward is number one. It's unfortunate that we have to always be looking for money when it comes to some of the very basic needs, such as healthcare. It needs to be prioritized. It needs to be prioritized at the state level. When we talk about fiscal prioritization, you know, one of the things legislatively that we need to look to do in this calendar is how do we, if you will, rack and stack? How do we put things that are most important up top, and then look at the things that, unfortunately, when we have to cut, what are the things that we can cut? Everything is very important, and there's a ton of need out there, but healthcare is not one of those things that we can afford to cut. I have a son with cerebral palsy, with spastic quadriplegia, which means he doesn't have the ability to use his legs, his hands. He eats through his stomach, through a button, and he's nonverbal. So folks like my son absolutely need care. They need hospitals. They need access to quality hospitals. And when we make these cuts, these budgetary cuts, it impacts them. So number one, from a legislative perspective, we need to look at prioritizing for situations such as this, so that we're not going back to how do we figure out what we need to do? Where's the money coming from? Unfortunately, that's the state that we're in. You know, I got elected in December. I came into office on December 2nd, and I walked into a deficit. And as a business owner, when you walk into a challenge like this, you have to ask yourself, okay, here we are today, but how do I fix it for tomorrow? And one of those things, you know, that we have to look at is, where are we spending? What's most important? And what is secondary? And we need to cut those secondary issues so that the primary issues, such as healthcare, is taken care of.
Thank you so much for that, Assemblymember Gonzalez. Now I want to turn it over to Senator Ochoa Bogh to add to that question.
Better mute myself so I can see that. So thank you so much for having the opportunity to be here with you. You know, healthcare is one of the most important things that we can, along with education, as far as looking to have thriving communities. Let's put a little setting right now in California so that the audience, if they're not familiar right now where we are in the legislative process, they may understand where we're going and where we are right now. So our new legislative year began in January. And so we've been meeting with different stakeholders throughout our community, throughout the state, in order to understand what the challenges are currently. And I do want to preface that because our committees are just beginning this month. We've been holding our budget oversight hearings right now. We just started meeting with our budget committees in different areas, including health and budget one, such as myself. So we're starting to hear where we are in different spaces throughout the state. So that's where we are right now. But much of the focus right now legislatively with the legislature is the focus on the lens on the federal level. But before we start deflecting to the federal level, we have to understand where we've been in California as a state, which is the fact that the state has been expanding demographics in which they want to serve. They've been expanding services that we would like to see being provided in our state, but we don't have. We all know, and as mentioned by our earlier speaker, Mr. McNaughton. I'm sorry, I just butchered your last name, and I apologize for that. But one of the things that we've known is that as the state has decided to expand services and demographics in which they want to serve, the state has what I call, quote unquote, pony up the bill. We haven't been fully reimbursing our healthcare providers as a state. So I want to focus on what we've done and what we haven't done as a state before we start deflecting to what the federal government may or may not do. We don't know yet. I know there's a lot of changes going on with the federal government, a lot of streamlining happening on that end, but let's focus on what we've done and what we haven't done in California, which is the fact that we haven't fully funded our ability to reimburse our providers. And when we have a challenged healthcare workforce in our state, especially in the Inland Empire, where we don't have the providers that we fully need. I mean, a lot of times, many of our residents are waiting 2-3 months to see a specialist in that area. And I know we have award-winning healthcare plans here, but needless to say, we're still very, very lagging behind, and we can't hold a workforce to stay here. We're graduating a lot of folks and seeing them leave. So I've been very supportive of anything that we can do to allow our residents to stay, incentivize them to be able to stay. I've been promoting more affordable cost of living in California, which is housing, in order to provide more healthcare workforce to stay and incentivize to stay in California. Now, having said that, the state has also been very, very proactive in regards to protecting themselves against federal mandates that may impose challenges for the state. Now, the state is facing a deficit again this year, proposed deficit this year. We're currently hearing through our budget hearings, oversight hearings, what is going on and planning to prioritize. So when Assemblymember Jeff Gonzalez mentioned earlier that we're going to be prioritizing, we're going to have to do that because the state is definitely going to have to make some hard decisions as to where to allocate funding and how much. But in that process, as we're having those conversations, I do have faith that many of my colleagues on both sides of the aisle, whether Democrats or Republicans, their best interests are that of the people. We do want to see ensure that we're not wasting funding on programs or projects that are not being cost effective and efficient. We have to really prioritize our needs versus our wants, and really have a focus on working collaboratively with the federal government so that they understand where we are. But there is a pickle, as we haven't expanded a prioritization in the state of California to expand our population of service, and how that may or may not conflict with the federal government priorities as to whom they want to see those services being provided to. That's where the challenge will be. And this is where California is going to have to prioritize, saying, okay, if this is a priority for us, then we're going to have to prioritize the funding to ensure that those services in the expanded population that they would like to serve gets served. So those are the conversations we're currently having at the state legislature, but they are in various spaces providing some additional funding to protect some of the service that may be at a threat at the federal level. The legislature is being very proactive on that front.
Thank you so much, Senator Ochoa. Well, now I'd like to go on to our second question. And some of this may have been covered in your original answers, but if you like to add anything additional to that, okay. What plans are being considered to continue funding programs if federal funds are restricted or diminished? An example would be like Medi-Cal for children and adults. So I'll turn it back over to Supervisor Baca if you'd like to address that question now.
Thank you, Jezebel. It's a great question. I just believe that a couple things to keep in mind. I believe we have a duty to provide health care. And what's unfortunate sometimes because of the mandates, people are brought to the hospital clinics and, we can't turn them away. So by law, you can't turn them away. So I think we have to do everything we can to protect funding, continue to lobby our federal, legislators, especially from the Inland Empire, and tell them, look, this is important. This is an important issue for us to ensure that individuals from our community aren't cut. When you look at 70% of Arrowhead Regional Medical Centers based on Medi-Cal, Medicaid reimbursements, that's a big number. That's a big number for our county. That's something to take notice of. And I think the next the next hospital is, I believe it's St. Bernardine's, which is 40%. So that's a big discrepancy between St. Bernardine's and Arrowhead Regional Medical Center. That's a big number, but I think we have to continue to try to do everything we can to protect this funding and advocate and lobby. And, I know that Erica Murray from the California Association of Public Hospitals is advocating. I know we're reaching out to our federal legislators to make sure, because you're impacting families. And as a father that has a child or children in school, you want to make sure the kids next to them have adequate health care. I think we have to continue to advocate and lobby. But as far as the county of San Bernardino, we are looking at our options. We are looking at cutting. We are having those policy discussions. Do we draw from the general fund? But we're really trying to cinch up our belts to make sure we can continue to provide services. I think that we have a duty. I understand that most people cannot pay out of pocket for public health care. I mean, we even as a government agency, we provide medical benefits, and it's very expensive for even us as a government agency to provide benefits, but we do it because we believe that, we have to make sure that people are healthy. But I just think we got to continue to lobby Congress and put pressure on them to make sure that they protect this funding, because this is just vital for our communities. Thank you, Jezebel.
Thank you so much, Supervisor Baca. Now I'll turn it over to Assemblymember Gonzalez to address that question.
Agreed with Supervisor Baca. Working with our federal partners is very important. And much like what the senator also said is we are currently in talks about how we prioritize the money, where we make the hard decisions, because we're at that point right now. Hard decisions need to be made, and vulnerable children need to be taken care of and protected. But unfortunately, what that means is in budget committees and through the legislature, we have to make some hard decisions, because we spent unfortunately money that we didn't have for many years, and we have to write the books. But that doesn't mean that it's not important for us to look at our kids and our families in the community. It just means that we're going to have to really take a hard look at where everything is going, from occupancy rates in buildings, state-run buildings. I mean, everything across the board it's necessary, because healthcare is a priority.
Thank you so much, Assemblymember Gonzalez. Senator Ochoa Bogh, I'll turn it over to you now.
Thank you. And Dr. Jezebel, let me go back. I probably mentioned already, and I don't want to sound redundant, but I think, as, for instance, as the vice chair for the Human Services Committee, when we're looking at, and we haven't even had our first meeting yet, but let me go back to the previous year that we've been working towards in a year where we've had a deficit. And that is that we're prioritizing the services that need to really truly stay and those that are going to have to be trimmed. But those conversations as legislators, I just want to be, I do want to be hopeful that first of all, at the federal level, that they'll understand where we are as in California and that they're not going to cut the funding that really serves the most vulnerable in our communities. I am hopeful, and this is where the relationship with our federal partners becomes so important, where your voice and your interactions with our representatives at the federal level is so important. Advocacy. As far as the state goes, your conversations with us as we're having these budget oversight hearings and our budget committee hearings right now, you folks have to let us know where the priorities are, where the true need is, so that when it comes to making those decisions can be made to fund those programs that are the most essential and most important. So I truly believe that we have good people representing us in the Inland Empire, both at the state, at the county, and the federal level, and that the people are at the heart of who they advocate for and legislate on behalf of. And as we continue on that and therefore from those conversations as we're moving forward, I think we're going to do what is the right thing, which is ensuring that the funding is where it needs to be in the programs that they need to be to serve those in our community. So I'm grateful. I love working with Supervisor Baca. I know that we share many of the same values, and I love working with Assemblymember Jeff Gonzalez, whom understands what it's about when it comes to the medical community and the needs for services that are needed in our community. So I'm hopeful. I really am hopeful. But the reality is that we are going to have to see and have cuts necessary. But you folks have a seat at the table, and your conversations with us, county, state, and federal, is imperative. So thank you so much for being engaged and giving us the opportunity to be here and have those discussions.
Thanks so much, Senator. So I will be moving on to our third panel question. And I do think Supervisor Baca may have had to drop, but the third question I have is, what actions are being considered to protect safety net programs which support positive health? So an example of that would be community-based organization funding, community clinics or FQHCs, senior services, education, or like food programs and lunch programs. So I will give that question to Assemblymember Gonzalez at this time.
It looks like he may have frozen. Jezebel, would you like to offer that?
Yeah.
Senator?
Senator Ochoa, would you like to chime in on that one?
Absolutely. So as mentioned before, just setting the stage of where we've been in California is the fact that, we have a healthcare workforce shortage in the state of California. We're trying to work towards ensuring that we have funding and programs available to incentivize and produce more of that workforce to our educational systems in the state. So we're working towards that and ensuring that the funding is there. I know those are the conversations that we're having both in education committees, in our budget one committees, and so we're working towards that end. On that end, as mentioned before, I don't want to sound redundant, but your voice is very important as we have the discussions as to where the funding should go, what programs should be prioritized, and it's through those conversations that we learn what the priorities should be and where we place them in our conversations within our committee. So, yeah.
Thank you so much, Senator. I'm not sure if we have Assemblymember Gonzalez back yet. I think he's been kind of going in and out of service. Wondering if I should move on to the last question or maybe.
Maybe so. Assemblymember,
Yeah.
are you with us or are you out in the ether? Okay, yeah, Jezebel, why don't you move on to the final question?
Okay, so last question, how can we best support state legislative actions or the agenda in relation to federal policies impact at this time? So particularly in relation to healthcare and services. Senator Ochoa?
Yes, once again, you are the biggest advocate for this particular space. Your organizations, your nonprofits, your medical associations, everyone who is involved in this space needs to make an appointment and meet with your local legislators at the state, at the county, and at the federal level, and really emphasize the needs and the programs that California, the budget needs that we are required, and how those decisions will impact our residents in the state of California. Be involved with understand the legislative process, which is why one of the reasons why I started with trying to help explain that right now in January or February, we're meeting with stakeholders, our oversight hearings for budget in our different spaces such as health and education and human services. Health and education are happening right now. Now is the time to speak to us and let us know. Letters of support would be great. And visits, one-on-one conversations with your local electeds is so important. Build those strong relationships so that the trust is built there, so that you become the authority in that particular space. And as we continue on our legislative process, whether it's voting on bills or voicing our opinion, voting on priorities as far as funding for programs in healthcare, we continue to vote in a way that actually reflects the needs of the state. So that is very, very important. I can't emphasize the importance of your voice in this legislative process, both at the local level and at the state and federal level. But your voice is powerful. It is powerful, and you folks are the experts educating us so that we can make the best decisions. In advocating for our region is so important. So can't emphasize that enough. And
Looks like we've got a little more freezing.
May have frozen there for a second. Thank you so much, Senator. And thank you so much for your contribution on this panel. I would like to turn it back over to Allison now. I think we want to have some open forum and address any questions that we may have had.
Thank you so much, Dr. Jezebel. That was really nicely done. And we really appreciate all of those thoughtful responses. It's very helpful to all of us as stakeholders. So thank you. We look like we have a lot of wonderful questions in the chat. So I am at this point going to turn this over to Tiffany Law, who is the program manager for the IEHP, who's going to facilitate some of these questions and just start going through them. Tiffany, I'll turn it over to you.
Yeah, absolutely. Thank you so much, Allison. I know we were trying to get some of the legislators back on the call. Were they able to? Okay.
Well, I don't think so, but let's go ahead and open it up to the senator and to Jarrod too, as well. And let's just start going through them so folks have a chance to discuss.
Perfect. Okay, so I know we got some feedback from Jarrod within the cuts to funding for immigrant children. So we'll wait for the senator to come back and then we can ask her as well. The other question was around, is there a group of healthcare workers / organizations where we can provide feedback on where in healthcare there is an opportunity of applying budget cuts? So I think they're wanting to know if there's any space where they can provide their feedback, what they're hearing from their community, or basically within any of the constituent areas for the legislators on what they think would be most beneficial for budget cuts.
Jarrod, hate to put you on the hot seat, but do you have any thoughts on that?
You know, our government affairs folks that are on the call are probably more versed in that than I am, but definitely the associations that so many of the entities are connected in and belong to. So as an example, Jody Wing goes on for, I believe she's on the call today, from Chaser, who represents all of the federally qualified health centers. They do incredible advocacy work for all of the FQHCs. I know that the two medical societies do that. You heard Supervisor Baca talk about the California Association of Public Hospitals and Health Systems do that. So our view on that is to really leverage the associations and advocacy groups that are created for each of those different entities. We can try to see if we can pull a list. I don't know, Vicki, if you happen to have any thoughts on this. You're our government affairs director. Vicki Osterman's phenomenal, absolutely one of the best. She may have more details on that for that question.
You're on mute, Vicki. No.
Can't hear you. Sorry, Vicki, but you could type, yeah.
Thank you. Okay, that's great. Does anyone else on the IEHP team want to weigh in on that? Or we can wait for Vicki's response. That sounds great. Tiffany, why don't you, while we're waiting for that, and we can loop back in case we would like to re-engage in some discussion on that, why don't you go ahead and go to our next question?
Yeah, absolutely. The next question is regarding in response to some of the recent federal efforts to regulate prescription drug prices through Medicare negotiations. Do you guys know of any California-based state policies that are helping to further reduce any drug costs and expand access to affordable medications for the residents?
Yeah, on that one, as you might have recalled, I know Governor Newsom had really hoped to get a insulin manufacturing program up and running in the state of California for insulin. I don't believe that that's in place yet, but they were sure trying to do that. For us on the pharmacy side, it's kind of interesting, the Medi-Cal program, the state made the decision to carve out the pharmacy benefit about 2 years ago out of the Medicaid managed plan or managed Medi-Cal plans in the state of California to try to have more leverage on pharmacy costs. But what's interesting to note is in that $3.4 billion loan that was requested by the Department of Finance to the general fund, it was noted specifically pharmacy costs are one of the reasons for that need for more dollars into the program, into the Medi-Cal program, particularly around the GLP-1 utilization. So it's a fascinating question because I think in some instances we're seeing some cost savings potentially on negotiated pricing that the state's doing because they've now pulled all of that together. But because the benefit design has changed, you're actually seeing the pharmacy cost increase. So I hope that helps answer the question, but that's the extent of my knowledge on that one.
That's super helpful. Do we have Senator Ochoa Bogh or Assemblymember Gonzalez back on yet? No. I don't see you, but if you're on, maybe we can hear you. Okay, I don't think so. I think they got cut off. So I want to jump in with a question before you continue, Tiffany. And I hope this isn't really like the elephant in the room, but you know, Dr. Frausto brought this up about the issue of the undocumented and the immigration considerations. How do you advise, I guess, Jarrod, that we respond to folks on this? Through our medical society, of course, we're advocating that, withholding funding hurts everybody. It causes a domino effect of hospital and clinic closures and so many of the things that you've all pointed out today. But I'm getting a lot of responses from folks who aren't, I don't think, fully understanding the repercussions of this. who say, well, as long as you don't provide the Medi-Cal funding to the undocumented, we'll go ahead with it. Well, that's not an option right now. It's all or nothing. So what are your thoughts on this? How do we deal with this?
Yeah, this is a tough one. I mean, on our call today with the 17 public plan CEOs, we actually put on our board agenda for next month to have a whiteboard session around areas that we feel like if we absolutely have to make compromise on, what would those areas potentially be? What is considered a core part of this program that if it were to go away would be catastrophic to the community? And so while we haven't put that list together just yet, I can tell you that as folks probably remember, the Medi-Cal program was originally designed for moms and kids. And then over time with the Affordable Care Act during the Obama administration, expanding that for those folks that were just right on the margin who could not afford personal coverage and were right above the line there on the federal poverty level. There are pieces to all of that if we have to make Sophie's choice on as a community, we probably need to come together, Allison, and have those conversations. Based on the lens that I see today, it's very difficult to see a path forward on the increased cost at the state level, as well as what the feds are trying to do without us coming to the table and negotiating something. I am a firm believer that the worst thing that could happen is us letting cuts happen to us without being at the table to discuss what would be in the best interest for the vast majority of our membership and our providers. So while none of that's been decided yet, to your point, Allison, I do think it probably would be good to have a community session even to discuss as a community if we had to really make the difficult decisions. What does that look like? It's probably time to do that here pretty quickly.
It's a really good idea. Well, you can count on us to support however needed to be a part of that discussion. That sounds great. Tiffany, forgive me for jumping in. I just wanted to ask that question, but you go right ahead. I see we have a couple of other questions.
Oh, no problem at all. I know some of the other questions were specific for legislatures. I believe I see one for John, from John, who was speaking about Prop 35, which is making a permanent tax on managed healthcare plans. I'm not sure exactly what we are backfilling. John, would you mind jumping off of mute and letting us know some more information about your question?
John may be muted there and unable to come off, but the question is, can Prop 35 funds help backfill some of the potential gaps? And Jarrod, you addressed that a little bit, but do you have a little more clarification on that?
Yeah, I think given what just happened this week at the state with that letter from the Department of Finance, it would not surprise me if another attempted sweep of those funds is pulled into the program and that this goes to court based on what the voters just voted on in November. Because we're at the point now on the funding piece of the equation where it would not surprise me at all if there's a tactic like that, or if significant cuts are made to different categories of aid because of deals, if you will, that are being made based on what we're hearing. So I think that, again, this is one of those areas where Prop 35, the goal behind Prop 35, for those that don't know, was to try to increase reimbursements as close to the Medicare level as possible for our physicians, because the delta on Medicaid or Medi-Cal to what the physician rate was for Medicare was pretty vast. And so the goal was to try to push up reimbursements. Again, though, this is one of those questions that as a community, we would have to really wrestle with. Do we want to see a smaller number potentially of folks that are covered by the Medi-Cal program at a higher reimbursement rate? or do we want to see more people covered at a lower rate potentially? And talk through that as a community to kind of figure out what does that look like, and what are those solutions that we can take to the governor's office and to the legislature. So I think the intention behind Prop 35, very good intention. We certainly, while we're a public entity and cannot advocate for or against something on those kinds of things, we certainly appreciated the coalition that put that together to try to increase reimbursement for hospitals and physicians. But again, I think this is one of those things where we may have to, as a community, come together and say, here's all of the funding that's coming in. Here's all the expenses, and where do we want to make choices to keep the program propped up? And I don't know yet what that full totality list looks like, but it certainly could include something like Prop 35.
Interesting. That's good to kind of maybe get an idea of what's headed down the pike there.
We have one other one. So you said that you worked with the other managed healthcare plans throughout the state of California in like a general CEO meeting. Is there any specific plans that the managed healthcare entities are doing to better support rural areas, such as within our own backyard, Banning or Beaumont, that are more heavily impacted by both federal and state funding?
Yeah, it's a great question.
Funding?
Yeah, there were several of us that have a significant number of rural hospitals and providers, partnership health plan that covers 20 or so counties in Northern California. Of course, Kern County, our counties, and others have significant rural impacts. And so we're all actually we talked about this today, about making sure that when we have our board meeting next month and are sharing some of these issues, that it's very clear that those cuts cannot be on the backs of rural providers, because already it is so incredibly difficult for us to get providers in for our region, Blythe, Needles, Trona, Barstow, those areas that are very, very impacted, where you're talking about hours drive away from the nearest health facility if something were to go away or change. So I really feel like, to your point, we've got to make sure that rural connection is super strong. So thankfully, there is a lot of discussion happening, kind of almost with a rural caucus on the legislative side to chat more about that. So I'm sure others may be on the call that even have more information on that.
Awesome. Thank you. Tiffany, do you see any other questions?
I have one more. Some people are privately DMing me.
Oh, okay.
Another one was around changes in Medicaid funding and if that will impact the adjacent resources that managed care plans are providing through Medicaid, such as social services, transportation, housing resources, and food services.
Yeah, absolutely. It could have a huge impact. Depending on how the feds decide to move forward with Medicaid funding in the state, could directly impact the Inland Empire, both on eligibility or the benefit design. As an example, our current waiver that we operate the entire Medi-Cal program under for Cal-AIM, I think only has 2 years left in it. And so it's going to be right in the middle of the current administration to request through CMS for a renewal of that waiver to allow for things like ECM or community supports. That's concerning because some of those programs that you folks work with directly are super vital to make sure that folks that are higher utilizers of the system that have chronic care conditions have those wraparound services to try to decrease ER admissions and ER utilization and have the care that they need through primary care instead of the ER and whatnot, in addition to the community supports piece. Now, again, there is opportunity, though, that we believe, even within the community support space, that there are particular community supports that from our perspective, we're seeing different levels of utilization. Some literally under 10 members utilize any of that particular community support. Others maybe have high utilization, but it's hard on the medical efficacy to really track and make sure that the member is using it rather than it being used by somebody else in the family. So we're really looking at all of that. Thankfully, our Chief Medical Officer, Dr. Takashi Wada, is actually on the state CalAIM waiver renewal task force for that. And so I'm so glad that our team is directly connected into that, but it's something very concerning where you could see a dramatic change based on that waiver approval in the future.
Thank you, Jarrod, so much. Well, I believe we have covered all of our questions. We do have a
We
couple of.
one more,
okay,
one more.
great.
Sorry.
No,
We
great.
have one from Angel that just came in about a minute ago. Do we believe ECMs would be towards the top of any potential suggested cuts?
You know, I don't see that, and this was just debated. This is kind of a fun question, Angel. We were just debating whether or not the feds, if they've approved a waiver, which they approved that 5-year waiver, of course, several years ago, that we're in the middle of utilizing right now, do they have the authority to pull that today? There was just some debate about that. It would obviously end up in litigation if they did try to do that. So I don't see that that would happen today, but it could happen with what I just shared about when the renewal process comes around for the waiver. We actually operate, I believe, under 2 different waivers, an 1115 and maybe a 1609. I don't remember what the number is, but we actually in our state under 2 different waivers under the CMS program. So I think you could see that in the future. I think it would be a high risk for the feds to make that change today because it would end up in litigation. There's no question in my mind for that.
All right. Thank you. Is that everything, Tiff? You think we got it?
All wrapped up. Thank you.
Okay. Okay, everyone. Well, this is the last chance. If anyone would like to say anything, we've got a couple of minutes left. Please jump in or raise your hand. Not seeing any. We will go ahead and give you a couple of minutes back today. We want to thank you so much, Jarrod McNaughton, CEO of IEHP, for joining us today and helping educate us about this and really encouraging us to get involved in this dialogue. And we want to thank our amazing elected officials, Supervisor Joe Baca Jr., Senator Rosilicie, Ochoa, Bogh, and Assemblymember Jeff Gonzalez for all the tremendous work that they are doing and for spending their valuable time with us here today. And I think the interaction with everyone and all of the folks so involved in this on the front lines really helps them as well. And we appreciate their perspective on that. So as mentioned, we will be sending out this recording along with, we've received permission from the IEHP team to share your video and your slides, Jarrod. So we really appreciate that. We do want to encourage everyone to join the IEHI again on May 6th for the upcoming Health Education Forum, which we hold those quarterly. And that topic will be centered around mental health in the Inland Empire. So thank you all so much. Everybody keep an eye on what's happening in the U.S. Senate today. See if we're going to, I don't know if any of the choices are palatable, but we'll see how they decide to vote today on keeping the government going or not. So, all right. Thank you again so much, everyone. Thank you, team. Thank you again, Jarrod. We'll see you all soon.